Very proud to say that I'm here with my son, Dr. Drew Sinatra. One of the missions that I've had in my life was to bring the ND and the MD together because I think it's the perfect fit in healing. I mean, I think the perfect degree is having the MD, ND, because the MD is used to taking care of a lot of sick patients, and they're very skilled at that, in the sense that they're hospitalized, with an acute heart attack, a stroke, a GI bleed, an automobile accident. So, I mean, I could roll my sleeves up and do wonders for people because I'm so trained in that form of medicine. Where the MD falls apart is chronic illness.
And with his training as a conventional cardiologist, I mean, these doctors are phenomenal at if you have a heart attack or a stroke or something like that, I want to see a cardiologist. I want to go to the ER and see a medical doctor. But if someone's suffering, let's say, a lung dysfunction issue, they've had chronic breathing problems for a long time, that's when I kind of see a naturopath because they might be able to help me more. And that's partly why I got the training to become a naturopath. I wanted to learn more to medicine than just pharmaceuticals.
I don't think naturopaths were really recognized as well. Actually, it was 15 years ago when I was at a medical conference and I saw this gentleman in front of me who had severe neurological disease. He was walking with a limp, shuffling his feet, very, very stiff. And I go, oh my gosh, this person's sick. And the next lecture was a naturopath talking on detoxification. And I got it immediately. I said, oh my gosh, that person happened to work in a chemical factory. And look at him, and now I'm listening to a naturopath talking about detoxification. I got religion.
I mean, he's a conventionally trained cardiologist, but he does all these other things. He's treating the gut, he's treating the immune system, he's working on detox, and he's doing all these things that really support the body, not just treating the heart, which obviously he needs to do in cardiology, but in medicine, you gotta treat the whole person.
15 years ago, I wanted to become a naturopath. And I literally, started reading books on nutrition. I was already making vitamins and minerals at that time, but I got my certification in anti-aging medicine, and I got certified by the American College of Nutrition. I became a certified nutrition specialist. I started reading about detoxification, and I realized that the perfect fit for what I was lacking was a naturopath. So I became a wannabe naturopath. And then when my son ended up going to naturopathic school, it was like music to my ears because now I had somebody in the family.
And that's really part of my vision, is to create more of a true healthcare and not just a disease care system that we have currently running. What we have today is a disease care society. We do not have healthcare. I mean, you think about when you go to the doctor, you're sick. You should be going to the doctor to learn more about your health. Learn about prevention. That to me is true medicine.
I mean, he has so many different tools that I wasn't exposed to. So that's why we brought him into Healthy Directions, and he's really going to complement and really thrive, in his own direction, but he'll really complement what I'm doing as well.